tonight.
I think it's unnecessary for a man to die from prostate cancer.
An ABC 27 special presentation.
It's a very treatable disease. If we treat it early, we can cure it.
Penn State Hershey Cancer Institute presents Prostate Cancer, a Matter of Fact. Brought to you by Penn State Milton S. Hershey Medical Center.
Good evening, I'm Chuck Rhodes. Excluding skin cancers, prostate cancer is the most diagnosed cancer in the United States. For American men, it's second only to lung cancer as the leading cause of death from cancer. In 2010, approximately 218,000 new cases of prostate cancer will be diagnosed, and more than 32,000 men will die from the disease. 1 in 6 American men will likely develop prostate cancer in their lifetime. Tonight.
Thanks, Chuck. A Dauphin County man and his wife had to make a very difficult decision. That's when he was diagnosed with prostate cancer. Just to let you know, there is a graphic shot of the surgery. Here's his story.
They've got trout and they've got smallmouth bass and rock bass.
67-year-old Fred Maddox knows all about fish. A rod and reel had been by his side since he was 7 years old. On this day, he casts his line in the Wiconisco Creek.
Got one. I don't keep the fish, I catch and release. I think that just the thrill of catching a fish and pulling him in and releasing him back so somebody else can catch him is a good thing.
But Fred's favorite pastime hit a snag. In January, doctors diagnosed him with prostate cancer.
I was actually devastated because you always have the feeling that it'll never happen to me. And then when it does, it's quite shocking, and I was quite upset about it.
I just bursted out crying. I didn't know. That was very devastating to both of us to find that out, because you know it's going to be a change in your life.
Fred and Nancy didn't want change. They had enough twists and turns in their lives, going back 45 years ago when they first met.
She was 16 and I was 21. I was in the military.
After a year of dating, Fred went to Vietnam. They lost track of each other until 15 years ago when Fred made a telephone call.
Nancy got on the phone and she said, hello. And I says, Nancy, this is Fred Maddox. You may not remember me, but I used to date you when you were in high school. And she went crazy.
I was shocked when he called me. And he said, you know who this is? And he says, Fred. I said, I remember you. And I was real thrilled. I was like on the top of the world that day.
Come to find out that she wanted to be with me as much as I wanted to be with her.
8 years ago, Fred and Nancy exchanged wedding vows.
Here we are, after all these years.
A promise to be devoted to each other in sickness and in health. So they faced the prostate cancer diagnosis together.
This is a picture of the prostate right here, and we have nice clear boundaries all around it. And the area inside the circle right in the middle here is the area of cancer. And what we can see is that it's confined to the prostate without any evidence of spread outside the prostate.
Dr. Jay Rahman talked to the couple about a few options to treat the cancer, including robotic surgery.
Robotic surgery is essentially just one type of minimally invasive surgery, basically making 3 or 4 small incisions and doing the entire surgery through there. One of the advantages of using the robotic technology is that the last 2 centimeters or so basically can mimic your wrist. I can essentially take this wristed instrument and move it 360 degrees forward, backwards, open and closed, and really move it all around in very narrow spaces at really just a fraction of the size of space needed for my own hand.
I was apprehensive, the old cliche, fear of the unknown. I didn't know what to expect, how much pain would be involved, the recovery time. But I elected to have it removed because that way there's no doubt in your mind that it's gone. And that's what I wanted.
I seen him right before he went in the operated room. You just can't help just crying, because you don't know anything could happen, you know, when you go in.
He did wonderfully. He did fine. The operative procedure was uncomplicated.
I was up and walking around about 14 hours after surgery, walking up and down the hallways. I had operation on Friday morning. and Sunday afternoon I went home.
Dr. Rahman delivered the good news a few days later.
His margin status was negative, which means all the cancer was out. Once all the cancer is out, you're already looking at an excellent cure rate.
A sigh of relief from Fred and Nancy. Now they can focus not only on the present, but their future.
His whole attitude is so much better than it was before, and mine too. We were both thrilled. You could tell he's more relaxed. Very happy.
He saved my life. It's the way I look at it. You know, he done the operation, got rid of my cancer, and if he hadn't have done that, I don't know what would happen. I'd probably end up dying from prostate cancer, although some prostate cancers are slow growing. You never know.
After all these years.
And the song, After All These Years, that's Fred and Nancy's wedding song. Fred had the surgery this past May. He told me he never took pain medication. In fact, he was on his riding lawnmower a week after the surgery. We'll send it back to you, Chuck.
Deborah, thank you. And the man who saved Fred's life, Dr. J. Rahman, is right here with us now. And first of all, that's got to make you feel great when you hear some patient say that.
Makes me feel wonderful.
Well, he chose to have the robotic surgery. How common is this procedure?
Well, the robotic approach was first developed in actually 2000, and since then its use has really skyrocketed over time, and that's largely because of its ability to revolutionize practice. They estimate in 2010 over 80% of prostate cancer surgeries are done by a robotic approach.
Why do you think this has become so popular, this robotic surgery?
I think it's because it benefits for both patients as well as for surgeons. For patients, certainly there's less scarring, a shorter hospitalization, less blood loss. And all of that translates to a faster recovery and back to daily living. For surgeons, we see and we visualize a lot better, and that allows us to remove the prostate with the cancer while preserving vital structures within the pelvis.
Can this type of surgery be used for any prostate cancer patient when they come in? You say it's a go?
Yeah. The answer to that is increasingly yes. We used to think that larger men or obese men or those with large prostate glands or patients with advanced cancer were not candidates for minimally invasive surgery. But multiple studies have shown over time that robotic surgery can safely and efficaciously treat all of these patients.
Now, if they're not a candidate for that type of surgery, what are some of the other treatment options available?
Well, certainly if you look beyond surgery, whether it be minimally invasive or open, radiation therapy, active surveillance, which is also called watchful waiting, as well as hormonal or chemotherapy for advanced cancers. And certainly the selection of one of those depends both on disease characteristics, but also patient preference.
Making a lot of progress, and it seems like a short time. There's a lot of progress here coming up. And right now, let's go back to the ABC 27 call center, check in with Deborah and see what we're getting for calls in there. Deborah?
Help us answer some of the questions here in the call center is Dr. Joseph Drabick. Thanks for being with us.
Oh, my pleasure.
This is the first question we have. My husband had radiation treatments last fall for prostate cancer. His PSA test following his treatments was below 1. Then at his 6-month checkup, it was 3, and the doctor said it might be a false positive. 2 months later, it was up to 4, and shortly after was up to 15. He scheduled a biopsy for 2 months from now. Should he wait? My husband is having anxiety over this.
Well, it's understandable that he has anxiety, and it's important to realize that the PSA is a very useful test, and we do use it for following a patient who's had potentially curative therapy, like radiation therapy in this case. But it does have some limitations. And for example, when you've had radiation therapy to the prostate's still there, and there's still a little bit of prostate PSA that's elaborated, and that's called the nadir PSA. So he had a very nice nadir. But you can have bumps in that, and sometimes, for example, if the prostate gets infected with prostatitis, that can actually falsely elevate the PSA. So doctors usually like to see what the PSA does over time to see if there's a trend in the increase, as was done here. But I'm concerned that his PSA is climbing up, and I suspect he may have recurrent disease and will need further therapy. The 2 months is not anything to get worried over. It's kind of typical, but I'm glad that he's being followed appropriately.
Okay, now the second question. A good friend of mine was diagnosed with prostate cancer over a year ago. However, he's received no treatment and says it's because it's a slow-growing cancer. Should he get some type of treatment?
Well, it's another very good question, because prostate cancer has a wide spectrum of badness, so to speak. There are patients who have very aggressive disease, and there's a large amount of patients, men, who have very indolent disease that is very slow growing and festering so that they die with their prostate cancer, then die of the prostate cancer. So in appropriate situations, observation is a reasonable thing. The important thing is that for each man, their disease is different and each man is different, so you have to kind of tailor the therapy to the man and his specific cancer. And watchful waiting or observation is reasonable for some men.
Okay, great. And we will check back with you in just a little bit, but now we'll send it back to you in the studio, Chuck.
Well, doctor, you heard him say about the slow growing, maybe the watch and wait procedure. Is this the type of cancer where we can do that? You can back off and say, let's see what happens.
Sure. A fraction of them you can. So some prostate cancers are slow growing. What we have to keep in mind, though, is that there are some prostate cancers that are more aggressive, that are fast growing. And so it's important for a patient when they're thinking about a watchful waiting strategy to have regular interval visits with their urologist, to check PSAs, to do repeat biopsies as necessary, to make sure that we're not missing a more aggressive cancer that may be spreading.
Do they worry if you say, let's watch a little bit? Do they think they should do something?
Not so much. I think that they trust that as long as there's a systematic plan for the watchful waiting, that they're not going to get lost in follow-up.
Okay, well, thank you. Thank you for joining us here tonight, Doctor. Appreciate that.
Thanks very much.
The Penn State Hershey Cancer Institute is looking for healthy male volunteers between the ages of 20 and 79 for a prostate research study. Participants will be required to visit the medical center 6 times over 18 months. Now, if you're interested, call Wanda at 717-531-1002.